Do you want to come with me to the Niacin Park? Okay, let's go. Hello there, this is niacin, also called vitamin B3. Helps turn the food you eat into the energy. Niacin also important for cells' function and development. How much niacin do I need? Average daily recommended amounts are listed below in milligrams of niacin equivalents, or NE, except for infants in their first 6 months. For birth to 6 months is 2 milligrams. For 7 to 12 months is 4 milligrams NE. For 1 to 3 years is 6 milligrams NE. For 4 to 8 years is 8 milligrams NE. For 9 to 13 years is 12 milligrams NE. For teen boys and adult men is 16 milligrams NE. For teen girls and adult women is 14 milligrams NE. For pregnant women is 17 milligrams NE. And for breastfeeding women is 18 milligrams. Niacin is found in many foods and is added to some fortified foods. You can get recommended amounts of niacin by eating animal foods, such as poultry, beef, pork, and fish, some types of nuts, legumes, and grains. Also from enriched and fortified foods, such as many breads and cereals. Niacin is also found in B-complex food supplements and supplement that only contain niacin with 2 main forms, nicotinic acid and nicotinamide. Are you curious what happens if you don't get enough niacin? Severe niacin deficiency leads to a disease called pellagra, which is uncommon in developed countries. This disease is characterized by rough skin that turns red or brown in the sun, a bright red tongue, vomiting, constipation, or diarrhea, depression, headaches, extreme tiredness, aggressive, paranoid, or suicidal behavior, hallucinations, apathy, and loss of memory. In its final stages, pellagra leads to loss of appetite followed by death. Can niacin be harmful to your body? Foods and drinks that contain niacin are naturally safe for consumption. However, dietary supplements with 30 milligrams or more of nicotinic acid can make the skin on your face, arms, and chest turn red and burn, tingle, and itch. This can also lead to headaches, rashes, and dizziness. If you take niacin dietary supplements in the form of nicotinic acid at a dose of 1,000 or more milligrams per day, it can cause more severe side effects such as low blood pressure, extreme tiredness, high blood sugar levels, nausea, heartburn, abdominal pain, impaired vision, and fluid buildup in the eyes. Long-term use can cause liver problems, including hepatitis and liver failure. If you take niacin dietary supplements in the form of nicotinamide at a dose of 500 milligrams per day or more, it can cause diarrhea and easy bruising and can increase bleeding from wounds. At doses of 3,000 milligrams per day or more can cause nausea, vomiting, and liver damage. Are you one of the following groups those most likely to have inadequate niacin status? Let's take a look. People with undernutrition. People who are undernourished because they live in poverty or have anorexia, alcohol use disorder, AIDS, inflammatory bowel disease, or liver cirrhosis often have inadequate intakes of niacin and other nutrients. People with inadequate riboflavin, pyridoxine, and/or iron intakes. People who do not consume enough riboflavin or vitamin B2, pyridoxine, or vitamin B6 or iron. Convert less tryptophan to niacin because enzymes in the metabolic pathway for this conversion depend on these nutrients to function. People with Hartnup disease. Hartnup disease is a rare genetic disorder involving the renal, intestinal, and cellular transport processes for several amino acids, including tryptophan. The disease interferes with the absorption of tryptophan in the small intestine and increases its loss in the urine via the kidneys. As a result, the body has less available tryptophan to convert to niacin. People with carcinoid syndrome. Carcinoid syndrome is caused by slow-growing tumors in the gastrointestinal tract that release serotonin and other substances. In those with carcinoid syndrome, tryptophan is preferentially oxidized to serotonin and not metabolized to niacin. As a result, the body has less available tryptophan to convert to niacin. So in this section, we talk about niacin might play a role in diseases and disorders. The evidence indicates that nicotinic acid supplementation improves blood lipid profiles but has no significant effects on risk of cardiovascular events. Although nicotinic acid is a nutrient, if very high doses or thousands of milligrams are taken to treat hyperlipidemias, the supplement is being used as a drug. Such doses should only be taken with medical approval and supervision. Thank you, and see you at another park.